Vaccines are one of the most effective ways to protect kids from many serious diseases, but the number of children in the United States who are up to date on routine vaccinations is declining. Today, Dr. Michelle Fiscus, the Chief Medical Officer of the Association of Immunization Managers, is here to talk about how important it is for kids to get their vaccines. Thank you so much for being here.
Thanks for having me.
So to start off, why is this backslide in childhood vaccinations concerning?
Well, the biggest reason is because if we don't have really high immunization rates amongst children, especially, then diseases that we haven't seen in a while, like measles and mumps and even chickenpox, can really start to work their way back into our communities and make kids sick and suffer from those illnesses.
I know there's a federal program called the Vaccines for Children program. Tell us about that and who's eligible.
That's right. So there's a very important program that parents need to know about called the Vaccines for Children program. It's actually been around since 1994. And what that program does is make sure that every child, regardless of their parents' ability to pay, has the opportunity to get the vaccines that they need for childhood to stay healthy and to prevent these vaccine preventable diseases. So children, about half of the children in the United States qualify for the Vaccines for Children program. And those are children who are insured by Medicaid or eligible for Medicaid, who are uninsured, who are underinsured, which means maybe their parents' insurance plan doesn't cover vaccines, and also for children who are Native American and Alaska Native. All of those children qualify to get vaccines at no cost through the Vaccines for Children program. And then the other half of kids should have access for free vaccines through their parents' commercial insurance plan.
How does access to routine vaccines affect other immunizations, including the COVID-19 vaccine?
Well, most children are going to get routine vaccinations when they go in for their well child checkups. And so it's a good opportunity to be vaccinated against COVID-19 as well. And remember, a flu vaccine is something that you should still be looking at getting. Even up until April or May of the year, we can still see flu circulating. So when we get kids in for routine vaccines, it's a good opportunity to get COVID and flu vaccines as well during this season.
I know some parents are a bit hesitant about vaccines. What would you say to them?
Well, first, I get it. There is a lot of information out there. It's really difficult to know what is real information and what is false information. And so sometimes it feels like the safer thing to do as a parent is to do nothing. And in this case, I want to assure you as a parent and as a mom that the safest thing to do is to get your child vaccinated to prevent these diseases. So we don't want to see children suffering from measles and chickenpox or even COVID and flu when we can prevent serious outcomes with vaccines. So talk to your trusted healthcare provider, talk to your local health department. They can help you understand what vaccines your child needs and how you can get those at no cost.
I know this is a topic on a lot of parents' minds, so Dr. Fiscus, we really appreciate you being here today and talking about this.
No, thanks so much, Caroline.